Good morning, everyone. Welcome to the last day of the Building Bridges Summit, June 23rd. The event is now live.
Good morning, all of you all out on the Eastern Shore and Norfolk and places in between. Thank you for joining us again today on Tuesday for the last session of Bridges Out of Poverty. As you remember, yesterday we talked about causes of poverty and how very complicated it was. It's not just a question of one person not having any money. It's situations that deal with the individual, with the community, with exploitation, and with community and economic structures. And when a community chooses to address the causes of poverty, all of the issues have to be addressed across all four segments of the research continuum. It's not a simple question of fixing that one individual, which is, I think, where some of the previous welfare reform initiatives from the mid-90s may have failed. It's a little more complex than that. After we talked about that, we talked about hidden rules, which are the rules that are part of the fabric of a society or a class or an organization. And you sometimes only know that a hidden rule is there when you realize you have broken it, and all of a sudden everybody goes quiet and is looking at you. And what we need to remember when we are working with individuals from generational poverty is that they need to know that hidden rules exist. And the rules that worked in your setting, in your house, in your neighborhood, don't necessarily work when you get to school or the workplace. And Rita Pierson gave us a good explanation of how mama rules are super important and generally take precedence, but when they are in conflict with school rules, then the child can run into some trouble. So today, the first part of our class, we will be talking about how generational poverty can impact health. So I'm going to share my presentation in just a minute. Let's see. There you go. So I'm sure you all are aware, many of you all deal with healthcare. The socioeconomic status rules that the richer you are, the healthier you are. The poorer you are, the sicker you are. So how does that work? One reason is that people with money, people in the middle class, people in wealth, if they start feeling bad and they take themselves to their primary care physician right away, they can generally deal with a problem before it gets to be overwhelming, before they get really, really sick. And people in poverty try and just deal with it. You know, maybe take some over-the-counter stuff and don't go to the doctor, so that when they do get to the point where they're absolutely miserable and they finally go to the doctor, generally the emergency room, they're sicker than they would have been had they gone to their primary care physician, if they had one, when they first started to feel poorly. So living in poverty is a risk factor for stress-related illnesses. If you go back to the first day last Wednesday and think about living in the tyranny of the moment, just consider the stress that a person is dealing with when they have to worry about will they be able to pay the rent because they missed a day of work, because the child was sick, because the daycare provider wasn't available. Think of the stress that produces in a person, and think of times in your own life when you have been under stress and the different ways that it evidenced himself for you. Was it a headache? Was it an upset stomach? Was it nausea? Was it lower back pain? So many instances of illness are stress induced. I went through a period when I had a job I didn't like, where I would wake up in the middle of the night and it would just feel like my stomach had tied itself in knots. And, I did what middle class people do. I went to the doctor. I had blood work done. I had an upper GI and abdominal ultrasound and so on. And there was absolutely no physical cause for it. Then I changed jobs and I never had that symptom again. That's just an example of what stress can do to your physical health. And living in poverty and the stress that brings with us is a risk factor for stress-related illnesses. Sometimes it can be due to a lack of access. And if you live in a more remote part of the state and there's not a whole lot of health care available, I'm sure you all are familiar with Tangier Island, where those folks, the population is dropping, and it's not cost effective to just have one doctor there all the time. So they don't have access, and that can happen in a smaller locality or a more rural locality. But in poverty, it's not entirely due to lack of access. Some of the poorest parts of the city of Richmond are within walking distance to the Medical College of Virginia. But even at the Medical College of Virginia, they expect you to pay. So the impact that poverty has on health is the average age of death for people in poverty is younger than for people in the middle class or wealth. Primary care for people in poverty is the emergency room. When my daughter-in-law told me about taking her son, my darling perfect grandson, to the emergency room on a Friday night because he had fallen off the monkey bars and broken his perfect little arm, she was astonished at the number of people who were there on Friday night because they had the flu or they had a very bad cold. And she said, I don't understand. Why wouldn't they just go to the doctor? And I said, because the emergency room is their primary care physician. That's where they go. They don't have necessarily a primary care physician. And even when you do have primary care, you may feel embarrassed or concerned about going if you still have a balance due at your primary care doctor. Whereas when you go to a hospital, they have to take you. The other thing is, and I learned this in two of the rural counties that I worked in, because there's a lack of transportation, when people need health care, they'll call the rescue squad. And sometimes, and this is what the rescue squad people told me, sometimes the patient will want to go mid-morning or mid-afternoon because they know that means they'll be at the hospital at the right time to get a meal, to get lunch or dinner. Now, the fact that it costs the rescue squad, hundreds and hundreds of dollars to even start the engine on the truck is not an issue. And we had one frequent customer in one of the counties I worked in, and the rescue squad president called me and said, why can't you just call them and tell them to quit calling us? And I said, well, because that's against the law is mainly why I can't do it. But so not only is the emergency room the primary care, but oftentimes they're calling an ambulance. And so the ambulance is going to take them to the emergency room. The other part of that equation is they go, if we're talking about the working poor, they don't want to take off work and miss, getting paid. So they go in the evening or at night, so they don't miss any hours and they don't cut their pay. So that's, again, is the the family doctor open at 7:30 at night? Generally not. Sometimes you find them that are, but generally not. So primary care is the emergency room. Dental visits are seldom. I'm not sure if any of you all are familiar with the remote area medical service that happens in Southwest Virginia every year, and literally thousands and thousands of people line up days in advance to make sure that they are seen, and the overwhelming majority of those patients are there for dental care because they don't have it otherwise. And most of the time they're there for an extraction because the tooth or several teeth have just gotten beyond the point of salvation. So the teeth have to be, just have to be removed. But dental care, with these thousands of people that visit the remote area medical care, they're there because they've not seen a dentist, or they haven't seen a dentist since last year when the RAM truck was there. And they do them in different parts of Southwest Virginia. I'm not sure what other parts of the state this happens in, but and they do them in whatever housing is available. I heard the Deputy Secretary of Health and Human Resources talking about visiting and working because she was an MD, and she said, I was treating people in a horse stall in a barn, and it had a profound impact on her, and that's why she wanted to get back into politics, because she knew that that's not what people in the Commonwealth of Virginia observed. A fourth impact of poverty on health is that the rates of obesity and diabetes are higher among people in generational poverty than among people in the middle class and wealth. And the fix for this problem seems relatively simple, right? Okay, well, just don't eat high fat, high fructose, nutrition empty food. Just eat healthy food. They tell you just shop the perimeter of the grocery store. Just go up the produce aisle, come down the meat and fish aisle, and then leave after going through the dairy aisle. Well, guess what's really expensive? The expensive stuff is the stuff on the perimeter. The fresh produce, the fresh meat, and the dairy stuff. When you go inside the grocery and you get the inside aisles where the processed food and the canned food and the packaged food and the junk food are, that's pretty cheap. A pound of chicken is way more expensive than 3 boxes of Easy Mac, or a dozen packages of ramen noodles. So people in poverty are trying to stretch their food money or their SNAP benefit by buying cheap food. Well, cheap food is very often high fat, high sugar, high fructose corn syrup, and it's basically empty calories. And the result from that is a higher rate of obesity and diabetes among people in poverty. Also, if you remember in the mental models, how many gymnasiums did you see in the poverty neighborhood? And what's the likelihood that a person can afford a gym membership? Also, when you stop and think about, again, going back to the mental model, how much time does a person in poverty have to devote to making sure that, they get their cardio rate up to 70% of their maximum, and, they take their 10,000 steps a day, and so on. There's all of these factors that contribute to obesity and diabetes, and also, I'm sure, heart disease and strokes and things like that. People in poverty smoke more frequently, and they smoke more cigarettes. Sometimes, like we mentioned earlier, access to medical care can be scarce depending on if you're in a rural area. And the allostatic load, which is the physiological response of the body to repeated or chronic stress caused by poverty, allostatic load can lower the IQ, which is really sad. You know, what people who deal with poverty, people who are in the professions that we are in, we get so irritated by the bad decisions that we think people in poverty make. And one of them is, why do people in poverty smoke? And smoking truly is hideously expensive. I'm just shocked every time I look at the prices. The only place you see them anymore, I think, is convenience stores, maybe some grocery stores. But you look at the prices, and they're $55 and $60 a carton, which is, 10 packs. And if people smoke a pack a day, they'll burn through 3 cartons in a month, which is $165 or so. That is a lot of money. But when a person is under stress, really doesn't have a whole lot of time in their work a day, the time that they do have is devoted to the tyranny of the moment, trying to get through today into tomorrow, and never has the opportunity to take a vacation. Doesn't get that week in the Outer Banks or the mountains that generally middle-class people who work every day get to take. That 10-minute cigarette break is the vacation. That's their moment. That's their time to reduce stress. That's their time for themselves to just go outside. And because Lord knows you can't smoke inside. So they go outside, often during the workday and smoke 1 or 2 cigarettes. Is that a good use of money? Oh, Lord, no. But I'm just trying to get through today. I am not thinking about the $165 that this habit of mine has cost me and probably my family. So you do find that the rate and the amount of smoking is higher in people in poverty than in people in generational poverty than other people. And that also plays into the fact that they die at younger ages than people in the middle class. So when you look at opportunity for health care, first you look at availability. Is it even there? Is it even someplace you can get to? Is it, if you're in a rural locality, is there transportation? If you have to drive 45 miles to get to health care, is that really available to you, particularly if there's no public transportation where you are? The second issue is access. Do you have medical insurance? Can you go there? Is this a place you can even go? The third issue is cost. If you don't have health insurance, a simple office visit can be truly expensive, and don't even look at the cost of breaking an arm or a leg. It's super, super expensive. What's the quality of the health care you're getting? If you live in a larger city, with multiple hospitals and plenty of primary care providers, you have choices and you have options. But if you live in a place where your options are very limited, where your choices are only possibly one guy, how good is that guy going to be if he's got no competition? How qualified is that? I have enormous respect for nurse practitioners, but is that necessarily going to give you the the treatment that you need if all you have is a nurse practitioner and you don't have the backup of the doctor. I mean, nurse practitioners are invaluable and they serve a very important role, but sometimes you need the opinion of of the doctor. When my youngest son had appendicitis, and I took him to the doctor, the first person who saw him was the nurse, and she said, "I think it's appendicitis, but I'm going to send in the nurse practitioner." And the nurse practitioner said, "I think it's appendicitis, but I'm going to send in the doctor." And the doctor looked at my son and he said, "Who's your surgeon?" So everybody knew it was appendicitis, but it was the doctor who made the call. So anyway, you may not have access to the same quality of health care if you're in a smaller or more rural area. Also, the efficacy. Again, if you're in a locality where there's only the one guy, there's no competition. He may well be overloaded with his patient load. Is he spending the time with you that you really need to really explain what your problems are, and so that you get an effective treatment for what's really bothering you? And then the last thing we look at is communication. If you go back to the language discussion we had last Wednesday, and you remember that children in poverty are not rewarded for asking questions by a parent who's living in the tyranny of the moment. So children in poverty very often don't speak up, don't ask questions. People in poverty are often intimidated by authority and power. So there's a barrier to communication that's based on language issues, as well as the viewpoint of the person in generational poverty, the viewpoint that they have of a person with power and authority. So all of those things together impact the quality or the effectiveness or even the access and availability of a person in poverty's ability to get good medical care that's going to take care of the problem. So in under-resourced families, which are basically your people in poverty, you'll find that at least one person in the household smokes. They use the emergency room when they are sick because they don't have a primary care physician. If they do go to the doctor and they get a prescription, they may or may not fill it. Or, and this is kind of scary, they might use the pills left over from the last time. Not just they were sick, but someone in their household was sick. They might sell the prescription if they get it filled, they might realize that the street market value of the prescription is pretty good, and so they'll sell it. Or they will take just enough of the prescription to feel better and then maybe save it for the next time somebody gets sick, or maybe somebody else in their family is already sick. So under-resourced families find or that doctors use words they don't understand and that the doctor doesn't really listen to them. It could be that the doctor is overburdened in a rural area, has more patients than he can adequately and appropriately spend time with. It could be that the doctor has very negative views about people in poverty and just is going to tell you what he thinks and not particularly interested in your input. Under-resourced people call a rescue squad for transportation. We talked about that a little bit, much to the frustration and expense of the rescue squad, which is in many localities totally volunteer. They raise their own money. And every time they fire up the truck, it costs them money. This is probably true of those of us in the middle class as well as wealthy people. If I don't like the doctor, I won't follow his advice. I don't think poor people own that. And as we mentioned earlier, people in poverty don't belong to a gym. There's no money to pay for a gym membership, and even if there's money, is there time or transportation for it? Children who grow up in poverty don't always have the opportunity to participate in athletics or any other extracurricular activities because there's no money for it and there's no transportation for it. As we talked about earlier, under-resourced families don't eat a lot of fresh fruit or vegetables. Those things are expensive. If I go out to eat, it's generally fast food. Fast food is cheap, and cheap fast food is generally lots of salt and lots of fat. That under-resourced families do not have health insurance, and they might fall into that divide between being eligible for Medicaid and having health insurance from your employer. When the Affordable Care Act passed, and then Virginia passed expanded Medicaid, people had the notion that insurance from the federal marketplace was going to be free. And that is not, in fact, what happened. People from the federal marketplace might have been at a better rate, but it wasn't always free. So there are still plenty of people who are caught in that gap between being eligible for Medicaid and having health insurance paid by your employer. Under-resourced people don't know what they weigh. And that may be just a simple result of just not having money to spend on a bathroom scale. They don't go to the eye doctor. They just buy those little magnifying reading glasses at the dollar store. That may work for a while, but I can promise you the older you get, the less likely that is as a long-term solution. As we talked earlier, poor people don't go to the dentist. They might pull a tooth themselves if needed, which terrifying to me, but that's what happens. Being overweight is okay where I live because everybody else is poor too, and everybody's heavy. Item 8, there is a notion that real men don't go to the doctor. They just tough it out, suffer through, and move on. And again, I'll do what he says if I like him. It's about relationship. Remember, relationship is very important to people in poverty. And often, too, if they do go to the doctor, they will trust the doctor to just handle the problem, to just provide them with the information, and they sort of relieve themselves of any responsibility. I have a sister who Googles everything, and when she goes to the doctor, in fact, she went some years back, and she had Googled the symptoms she was having, and she had diagnosed that she had a thyroid problem. And I'm sure her doctor was very appreciative of that, except for the fact that what was really going on was that she's diabetic. So not sure how much doctors appreciate patients who Google their solutions, but people in poverty, because of their fear and awe of those in power with responsibility, they just say the doctor's going to do the right thing. I'm going to take the pill, get the shot, do whatever, and I don't really have to make a decision or decide what's right or wrong. The doctor's going to do it. By contrast, families that are stable, which are your middle class and above, mostly go to the doctor yearly for a checkup, mostly have health insurance, very often belong to a gym. Their kids participate in athletic activities. They have a family doctor. They have someone that they can call at 9:30 at night when their child is running a raging fever. Um, People in stable families get the prescription filled when they go to the doctor. Weigh themselves regularly, whether it's once a day or once a week. They get their teeth cleaned twice a year. They go to the eye doctor every year or two and generally eat a healthy diet. Um, these are stable families, which are families with dependable income and health insurance and so on. And all of these things produce long-term health benefits. If you go to the doctor yearly, you very often short circuit a condition that would get worse if you let it go untended, until it got to be a huge, obvious problem. Having health insurance, I heard someone say not too long ago that they couldn't go to the dentist because they didn't have health insurance. Well, the fact of the matter is you can go. It's expensive, but you can go. But we're so conditioned to think that if you don't have the insurance, you can't even go. People who belong to a gym, I have found out the hard way, it's not enough to just pay the dues membership every month. You actually do have to go and use the gym. But you can only do that when you have the time, when you're not struggling through today to get to tomorrow. You have to have the time to go to the gym. So all of these things, all of these items contribute to, long-term health, both for the parents and the kids. So the results of poverty's impact on health is that, number one, life expectancy is 10 to 15 years less, and that's a sobering thought, to think that because I am middle class and you are poor, I get to live 10 to 15 years longer. And the fact is, those 10 to 15 years are probably going to be more pleasant for me than your last 10 to 15 years, because I'll be able to deal with whatever health issues come along because, I have health insurance. I have access to available medical care, and I live in an area where there are enough options for medical care that I can make sure that I get quality medical care. Children are more prone to accidents because they're in an unstable environment. And we didn't talk a whole lot about housing, but I just read a statistic that a 2018 study by the Coalition for Affordable Housing learned or determined that people who earn a minimum wage have the opportunity to afford a two-bedroom apartment without it impacting their income by more than 30%, and 0% of the counties in the country. So the access to affordable housing is very, very limited, which produces unstable housing for people who are paying more than 30% of their income. So the kids are in unstable housing in an unstable environment. They have less supervision. Maybe their parents have taken a gamble on leaving them at a too early age just to babysit themselves or babysit their younger siblings. Or maybe their parents are working two jobs or caught up in the tyranny of the moment. So the children in poverty are just more prone to accidents and are going to get whatever care they need at the emergency room that night when mom comes home from work. We talked about this a little bit. Cheap food is fattening food. I don't know that you can get anything any cheaper than McDonald's. If you're buying prepared food and you eat one of those combination meals with a a Big Mac or a double cheeseburger or something, and the fries and the Coca-Cola to go with it, that's your whole calorie allotment for the day. That's it. You're done. It's very fattening food. There's a lot of calories and not a lot of nutrition. People are obese, and yet they can still be hungry because they're eating calorie dense but nutrition weak food. A lot of poor people live in food deserts. There's no source for healthy, fresh food. The 8th biggest vendor for the SNAP program in Virginia is our dollar stores. The largest vendor is Walmart, and then I think you have Kroger and Food Lion and so on. Well, in those big stores, those chain stores, there's plenty of opportunity for fresh produce and lean meat and fresh dairy and so on. But if you've ever looked at the food in the dollar store, what you're going to get is frozen, packaged, and canned. And those processes really strip away all of the nutrients. But if you're living in a locality, in fact, when I worked in Powhatan, one of my neighbor localities had no grocery store at all. So they either bought their food from the dollar store or they had to find transportation to come down to Powhatan and go to the Walmart or the Food Lion. But when you live in a food desert, you're either going to pay more because you have to pay for the transportation as well as the groceries, or you just have no choice for more nutritious, healthy food at all. USDA supports farmers markets, and in some localities, I think Abingdon in Washington County in Virginia started this some years back. When a person can go to a farmer's market and use their SNAP card, and the farmer's market, they decide, I want to spend $10 on fresh produce that's locally sourced from a farmer in my locality. So they pass over their EBT card. $10 is deducted for the EBT card, but the farmer's market gives them $20 in tokens, so they can double their spending power by going to a farmer's market and buying fresh, locally sourced food. I'm not sure of what other localities are doing that currently in Virginia, but if you have a farmer's market and you can figure that out, it does a lot as far as helping people have access to fresh produce. We mentioned before that diabetes and obesity are more common because people are not eating nutritious and high quality food. Dental care is infrequent or never. And dental care, as I'm sure you all know, is not just about having a pretty smile. It's critical to nutrition. If you don't have teeth, or your teeth are bad, or your teeth hurt, you just can't eat the right kinds of stuff. You can eat a lot of ice cream and you can eat a lot of chocolate pudding, but you're probably not in the mood to eat a healthy salad. And then smoking is more common in poverty just because of the opportunity it gives a person for a little break and a little relaxation. And smoking in and of itself is a whole nother issue in health care. Kids living in poverty experience more toxins, more noise, more violence. That produces cortisol in the children, which can interfere with other bodily functions. And then lastly, poor people are uninsured. Uninsured people don't seek preventative care. By the time they get to the doctor, the illness may be severe, and their primary care is the emergency room. So this is probably a good moment to take a break before we move into how to put these concepts and principles into practice. So I'm going to
Kathy.
Yeah.
I have one question from someone before we go on, and the question is, do you think the Tuskegee syphilis experiment has anything to do with some poor people not trusting doctors?
What experiment is that? I don't know that I know that.
The Tuskegee syphilis experiment?
Oh, I'm sorry. I didn't hear you say Tuskegee.
Gotcha.
I am sure that for people who are aware of that, I'm sure that probably plays into that. You know, as well as other issues around poverty, you're not likely to trust someone who tells you something that you don't want to hear, or who offers you solutions that you can't afford, that you can't implement, or who's using formal register and language that you're not familiar with, and you're not comfortable with challenging authority. So I'm sure that those kinds of experiments and those kinds of situations that have happened to people in poverty over time, I'm sure that those play into it, but I also think that there are a lot of other things that play into it as well. Were there any other questions?
That was the only question that I had, but if anybody has any questions and you want to type them in while we're on break, Catherine can answer them when we get back.
All right, so I have 9:40, so we'll start again at 10 minutes to 10. So welcome back. It's 10 minutes to 10, and hope you all had the opportunity to walk around and stretch your legs a little bit. We are going to start again. I'm going to share my screen. Hope this works again. And talk about how you begin to put these concepts into practice. So, Vicki, are you all seeing my screen?
Yeah, we can see it.
Okay, okay. The lovely map of the Eastern Shore. So you all have had some exposure to a lot of the Bridges concepts and constructs, mental model, impact on language, resources, hidden rules, causes of poverty, impact on health. So you know a lot of stuff now. You may know a lot of stuff that you didn't know this time last week. So how do you begin to put the practices or to put the concepts to work? So I think that you all have taken a significant first step by finding community partners interested in the same program and the same outcome. So that's a significant first step. This is a model of the Bridges implementation practice and what it looks like. And if you go to Bridges Out of Poverty training, they give you Legos to build this little model for yourself. And I have to confess, I just gave my Legos to my grandson, and I look at the picture. I'm not always a rule follower. So you see at the very foundation, at the bottom, the pale gray, you see the Bridges Out of Poverty constructs and language. And and I think we have gotten into that. We have started to build a foundation for you all. The next layer up, we know that poverty is something that has to be both looked at from and addressed to the individual aspect, the institutional aspect, which is whatever entity you yourself are employed in, and then both from the perspective of how poverty is looked at by your community and what your community needs to begin to do to resolve it. So in the individual column, you'll see that there are resourced and under-resourced people, and we talked a little bit about that just now when we did the health issues. And so those are the people that have to be at the table. From the institutional perspective, it's very important that you select an appropriate board to oversee your Bridges initiative, and that those people get the appropriate training so that not only do they understand the concepts and the constructs, but that they can begin to implement those things. And then at the community level, you need a steering committee. You need to have the selection and the training guidelines for those people as well. Then the text that the AHA process recommends for that is over in the left-hand column, and it would be the Getting Ahead text. You have an evaluation at the next step of the training that you've done and the steps that you've taken thus far as far as finding people to help build and manage the process, and you determine what your designated outcomes are. Then at the individual level, the next step is you'll probably want to have someone in your consortium trained, because the training has to be continuous. You can't just train one group of people one time, because hopefully you'll be pulling people in, including people from poverty. The issues for discussion are how much of yourself do you own, and financial literacy. Financial literacy is one of the steps that people have to understand and have to begin to build a stable life on the way out of poverty. In the individual level, you have to consider case management as you begin to roll people through your program. And then, if something doesn't work in the program that you're building, you have to be willing to evaluate it and change it if it's not working in your policies and your procedures. At the community level, you get your different sectors involved. You begin to identify barriers to progress that you make. And you begin to look at what the future story for your community would be as far as quality of life and people having access. And the text that AHA Process recommends at this second step of your foundation is the book Staying Ahead. At the individual level, at the third step, you're beginning to collect a significant amount of people who are now moved from under-resourced into resourced people, so that their environment is more stable and they are more securely on the path up, onward and upward and out of poverty. The next step for the under-resourced people is the staying ahead development and data, because you want to monitor where people are as they move through the program that you develop. The institution is going to always be evaluating the return on the investment. Is what you're spending in both time and money and energy, is it producing what you want, and are you developing the appropriate partnerships in your community? And from the community level, you're looking at the institutions and how they are reaching out and being pulled in, and then you continue to plan for growth, for a sustainable lifestyle in your community. And then your top layer is your philanthropy, your policy, and your quality of life. And this is when the three pieces begin to merge together. So everyone is at the planning table to eliminate barriers, both your resourced, your under-resourced, your community, your institution. There's leadership development, and it's critical, again, particularly if you run a program like Getting Ahead, it's critical that the people who have participated in your program begin to give back, because those are the people that have the most credibility for people in poverty, is the people who have been where they are and have been able to climb out of it. And you hope that you can find or begin to develop funding sources to maintain your program. And in your community, of course, you want to develop succession planning and endowments, so that your program or your model isn't just dependent on Vicki and social services. It has to be able to continue to move forward. So maybe this would have been easier to understand if we all had Legos in front of us, but I think this diagram helps you understand that this is a complex process, number one, and number two, that it has to be addressed much like the causes. I mean, the program that you build has to be to address all of these levels, much like the causes of poverty, have to be addressed across the levels of research. So as we continue to move forward, I think we're going to stop at one point and give you all the opportunity to make any questions and comments. And then also, just before we finish, I just want to let you know that we'll be posting an evaluation, and it will be, I think, 7 questions, but they will come out one at a time. So you need to be sure to pay attention to the poll and answer each question. And I think we'll give you 30 seconds or something to answer it. And I'll remind you again as we continue to move forward. So I know you all already have a lot of people at the table, but maybe these are some of the people that you haven't gotten or haven't thought of. So clearly local government, your banking community, because that's where you'll find funding, your faith community, your law enforcement community, obviously social services already at the table, higher education, healthcare, I think healthcare is at the table, educators from kindergarten through 12th grade, and I would also say any preschool or Head Start program that you have, people from the arts and entertainment world, and media connections, so that you've got a way to distribute and disseminate information. It's hard to get people to the table sometimes if they don't understand what the problem is. And so I know whenever I did my budget presentation in the various localities I worked in, I explained what the return on the investment for the local dollars was that that my locality had spent. So what we found out was that what was spent on Medicaid in the locality was as much and probably more than the whole local share of my budget, the local contribution of my budget. But people need to understand that when you begin to spend money on solving problems, the problems become less expensive. And for some reason, that's a hard one for people to get to understand. If you present it as if more people are employed and earning money, then there are more real property and personal property and sales tax dollars in your community, and the community is healthier, both fiscally and physically as a result. So in bringing people to the table, we're looking at various resources for people, the financial and emotional, and you look at for this person, are they unstable financially or stable? And do they have so much of a resource, is it abundant? And you go through all of the resources to determine in the community, after having evaluated your participants, what resources are unstable? Are your physical resources unstable? Do you have a lot of people with health problems? Or do you have a lot of people who really don't have the appropriate role models and relationships so that they learn hidden rules and good behavior in the workplace? When you determine what your unstable resources are, that helps you determine what kinds of things you want to put into place. For example, if your emotional resources are unstable for most of the people you're working with, you're going to want to figure out how you can provide more access to mental health counseling. Same with mental health. If your spiritual resources are lacking for most of the people that you have evaluated, you're going to want to figure out how you can get your faith-based partners more involved, not from the perspective of rounding up folks to be in their congregation, but from the perspective of offering a source of spiritual guidance. Are there a lot of people in your locality who don't have a support system? That might be a way to link your faith-based people with some of your participants, because they can provide sometimes just guidance. This is what you do when your electric bill is about to be cut off. You call the provider and make a payment arrangement. That's the kind of thing that you just might not know, but somebody in the middle class will know how to figure out. So you could use your volunteers in your faith-based communities or your civic organizations and link them as a partner or a mentor with your people who don't have a support system. In the relationships and role models category, if you're lacking those people, maybe your Rotary Club or your Lions Club or a civic organization would be willing to mentor people and help them learn what the hidden rules of the workplace are. So this slide helps you collect the data that's needed to determine what the major weaknesses are in your locality, so you can begin to develop what a program would look like and who at the table would be able to link people, participants in a program, with a support system or a role model or a spiritual resource. So the next several slides are assessments in your community of your starting point, your jumping off place, and where you are right now. So is the percentage of people in poverty going down? I'm going to go ahead and say probably not. Or the percentage of people at 200% of federal poverty. And we use that because a lot of the benefit programs that people are eligible for are sort of based around somewhere between 130% and 200% of federal poverty. Do you have more kids or less kids getting free and reduced lunch? Is the income disparity between the poor people and the rich people, is that getting bigger or is that getting smaller? Are there business loans in your community, and are more people able to take advantage of those? In your community, are there different kinds of businesses coming out? Manufacturing, service, technology, knowledge, health, construction, tourism, all of those kinds of things. If everybody in your locality works at one factory and that factory goes out of business, then your whole locality is at risk. And we've seen this in Virginia and in the western part of the state, when furniture businesses and shoe manufacturers went out of business, and the whole entire county pretty much took a hit because that's where everybody worked. Same thing happened in Southwest Virginia when the coal mines started to close. There were entire communities of people who were basically coal mining families. And I think at one point in time, there were like 40,000 coal mines in Southwest Virginia, and now there are somewhere around 4,000 left. That number might even be reduced further. But that has a huge impact on a locality. And if that is the major source of employment. So it's critical that a locality have a diversity in the employment sector so that a hit in one place won't cripple the whole entire locality. A good economic indicator is that there are a significant number of people employed in locally owned businesses. There's a mix of employment opportunities so that people can move up economically. It's good to have jobs in the in the beginning or unskilled category so people can get a start. But then you don't want that to be the only thing, because then people are stuck in sort of the minimum wage trap. And, we just learned that the number of housing opportunities for people who subsist on minimum wage is minimal at best. The investment in a community's infrastructure is rising. Is your community able to pay for capital improvement projects? Are the schools in good shapes? Is the water system in good shape? Are the roads in your locality in good shape? Very healthy economic indicator if your locality is healthy in those areas. If there is a downtown or a village area, are there fewer empty storefronts, or is that rising? The things on this slide are things that you look at in your locality to assess where your economic conditions are. Because of the pandemic, this is probably an unpleasant exercise at this moment in time, but hopefully, and I believe that things are beginning to get better. The next slide is about housing. Are there units for low-income renters that are 30% of income or less? 30% is the drop-off place for a reasonable amount to pay for your shelter without putting an undue burden on yourself. What's the percentage of actual homeowners in your locality? And is it rising or is it falling? Utilization of homeless shelters is going down. Homeless shelters are, I think of them as a necessary evil. You kind of have to have them, but if your solution for homelessness is to put people in a shelter, you've kind of put them in a limbo, because the more time they spend in a homeless shelter, the harder it is for them to get out of a shelter. So the more effective solution is to get them back into housing, into stable housing as soon as possible. Like I said, homeless shelters are a necessary evil. The rate of people doubling up because somebody has been evicted or their housing is unstable. If the number of people in your locality doubling up is going down, that's a good indicator. Again, the number of vacant and abandoned houses and other structures is going down. Segregation is by economic class is going down. You are not polarized into the poor neighborhood and the rich neighborhood. There's more of a blend of families. There was a newspaper columnist in Richmond who worked the police beat for about 17 years, and when he spoke, he would ask people, what they thought the cause of poverty was, and people would come up with drugs, substance abuse, poor education, and so on. And he was 100% convinced that the cause of poverty in the city of Richmond was the subsidized housing, the projects, because you create a little neighborhood of under-resourced people who are really living in the tyranny of the moment, getting by from day to day to day. And that perpetuates itself because it doesn't really offer anybody the opportunity to get out of it. And, people can, not that everybody in a project resorts to crime, but it certainly can happen. And I had a fella tell me one time when I visited, I was on a committee and had to visit the prison in Powhatan, one of the prisons in Powhatan County, every other month. And he said, you grow up in a neighborhood like that, and right is wrong and wrong is right. If you're making good money because you're, dealing drugs, you look like a hero. But if you're making minimum wage because you're frying hamburgers at McDonald's, you look like kind of a schmuck. So that put me back to housing segregated by economic classes going down. Item 7, housing co-ops and mutual renting of homes ownership by people not related to each other going up. For example, people buying a duplex together. Housing that is inadequate, overcrowded, or costs more than 30% of income is going down. A problem that a lot of localities face is that inadequate or inappropriate housing can be risky or dangerous. I remember hearing about a house in Powhatan that had not been cared for, and there was a hole in the kitchen floor that went right down to the crawl space. And what the family did about it was they put a rug over it, which seemed imaginative but iffy. And so someone had called the building inspector about this house because it really was just a dump and dangerous and all kinds of things. And what the building inspector said to me, well, I can condemn the house. Well, where are these people going to go? And I think that's a dilemma that a lot of localities face. Yeah, the housing is inadequate. It might be unsafe or dangerous, but there's not a lot of option. So when you have those kinds of situations, housing that is inadequate and so on, you want to see those situations going down, certainly not increasing. A waiting time for subsidized housing is getting shorter. I recently worked in a locality that still had Section 8, and I was truly stunned because I didn't know anybody had Section 8 anymore, because the waiting time, the list, you could wait 2 and 3 and 4 years, and that's not really a solution. That's not really helpful. So waiting for subsidized housing lists getting shorter and the number of homeless people going down, these are all indicators of positive community assessment of housing. I'm going to try and go through these a little more quickly because it's still several of them. Financial and banking conditions, loans for small businesses and startups increasing, Community Reinvestment Act scores improving, participation in community reinvestment by people in poverty and near poverty going up. Banks are providing typical and fair financial services to low-wage earners. Credit unions and banks offering fair loans to low-wage earners. And this is why you need your banking community at the table when you continue your planning. Financial literacy classes are available to people in poverty and near poverty. We ran the Community Action Program in Powhatan, and we could help people with rent payments and, when their utilities were cut off and so on. And we always offered them a financial literacy class. But what we found out was once the emergency has been fixed that time, they're not interested in a class. So we were sort of shooting ourselves in the foot every single time. But offering financial literacy classes, for people, particularly people who haven't had a role model, is productive. More loans available to low-income people. Percentage of disposable income that people can save is going up. Dollars spent in the local economy goes up, and per capita debt going down. That means the amount of credit card debt or other debt that people have in your community is going down instead of going up. The assessment for wealth creating conditions, median household income going up, average earnings going up, hours of labor required to meet basic needs is going down. So instead of people working overtime all the time, they can support themselves by just working a 35 or 40-hour week. Number of employee-owned businesses on the rise. The rate of CEO salary, and this is really a sore spot, the CEO salary ratio to frontline staff is going down, which means there's less disparity between what the people on the lower end of the pay scale compared to the guy sitting in the big chair at the top. Employers use less temporary help and have more full-time permanent help. Clearly, you have to have affordable and high-quality child care so people can go to work. You also have to have transportation so people can get to work, and it's reliable and affordable. Some communities have a living wage ordinance. The only one I know of right off the top of my head, I think Charlottesville tried that a couple years ago. Number of businesses using Bridges concepts on the rise. These are the things, an assessment of the things that you need to look out for. These are the things that indicate exploitation in the community by predatory people. And we talked about a lot of these: payday lenders, cash advance, and check cashing outfits going down, while alternative to those kinds of things are going up, like loans to low-income people or low-interest loans to low-income people going up. Employers developing those low-interest loans and saving strategies for their workers. Alternatives are being developed for the buy here, pay here car dealers, because those, when the car dealer finances the loan, very oftentimes the interest rate is a little exploitative. The Chamber of Commerce, Better Business Bureaus, and other business organizations take a stand against predatory business practices. The number of employers who ask employees to work off the clock without pay is declining, and that's just, in my mind, unconscionable for people to do that. Minimum wage violations going down, workers' comp violations going down, human trafficking going down, and drug trafficking going down. The education conditions, affordable preschool, early Head Start enrollment, graduation rates, all of these things should be increasing. Standardized test scores increasing, graduation rate for first-generation low-income college students going up. Apprenticeship and certificate programs that lead to well-paying jobs on the rise. Worker skills increasingly meeting the needs of employers. That would be your human capital, are increasing to meet the social capital in your locality. Cost of college education is declining. The digital divide, which is the gap between those with access and computers to those without, is narrowing. We've learned how dangerous this could be during this pandemic, when the kids in Richmond were let out of school in the middle of March, and teachers were supposed to be providing lessons electronically, which is great if you know that every single kid in your class has both a computer and an internet connection. And that just isn't always the case. So an indicator that the digital divide is narrowing is the sign of a healthy situation for education. And the number of higher institutions of higher education using Bridges concepts is on the rise. And I realize that this is an awful lot of issues and organizations that need to be assessed. And you certainly don't start doing everything all of the time, all at once. Your planning group would want to review these and decide for your particular locality, given the data that you already have, and what you think you can accomplish, you might prioritize your various assessments. So some of them would be more critical to you as a beginner, as a beginning assessment, and some of them might be more conducive or more successful when you are further down the road. This is public sector conditions, and I don't think I'm going to go this one item by item. This is a health assessment, and I think since we just talked about health, uninsured people, the number is declining, the cost is declining, high quality food is accessible, environmental safety is improving, transportation and access to healthcare is improving, neighborhood crime is going down, mental health and addiction treatment is affordable and accessible. You know, almost every single year, the General Assembly, somebody in the General Assembly, or sometimes as many as 6 people in the General Assembly, will put forward a bill demanding drug testing for people on SNAP or temporary assistance to needy families. And they never seem to understand that even if we were able to identify addiction issues for every single person on SNAP, does our locality have the resource necessary to help the person get better? I mean, it's not enough just to say, gotcha, you're a drug abuser, and cut them off of the SNAP program. Do we have the next step for them so that they can get healthy again? Let's see, preventive health care is on the rise for everybody. Overall fitness in your community is on the rise, and health disparities, that is the 10 to 15 years the middle class and wealthy people get that poor people don't get, is also on the decline. Leadership conditions, I think this one is something that would probably come later in your planning. And so that it's just about 10:30, and that is a very quick run through of the kinds of assessments that are helpful when you begin to develop what your Bridges Out of Poverty program is going to look like. So I thought we could maybe take 5 or 10 of the remaining 30 minutes, and just give you all the opportunity to make any questions or comments about not just the assessments we just talked about, but any other issue or concept that we've talked about over the last 3 days and today. So, Vicki, are you okay with that, or would you rather do something else?
No, that sounds great. I would encourage everybody. The only comment I have so far is a recommendation that the library is also at the table when we do this, and I absolutely agree with that.
And I actually think I saw somebody that was from the library in Eastern Shore. I think I saw that person, so that's good. That's an excellent recommendation, and you all are there with that one.
And so if everybody can take just a minute or two and type in any comments or questions that you might have. If I think most of you all either have my email or Patty Kiger's email, and even after this, if you have any questions, you are welcome to send them to one of us, and we will pass it on to Catherine. And we will be having a meeting of everybody who's interested in joining a work group to look at this on August 5th at 10 o'clock. If you can't attend at that time,
And I'll send out an email to everybody that signed up for the class, signed up for this training. And as a reminder, and if you want to be involved, but you're not able to attend that day, just send me an email and we'll make sure you get invited after that. So I'm still not seeing any comments or questions coming in. I don't know if that means nobody has any questions, or Catherine, you did such an awesome job. Everybody understands everything.
Pretty sure that's not it. And I see that the poll is already, is the poll live now?
I think they have finished the poll.
Oh, okay. Okay.
Okay, so I have one question here. The person asked, do you have any advice for identifying hidden rules?
That is a good question. I think you really have to, I mean, if you're in your office and you have to walk around the building and look at everything, look at your kitchen, look at your copy machine, look at your front desk, and stop and think about what's our process here for that. I learned a long time ago, when you manage people, you should never, ever, ever assume that anybody knows anything. I had a problem with an employee one time because she just couldn't get to work on time. The sign on the door said we opened at 8:30. She was the receptionist. So I thought she, knew that she needed to be there at 8:30, but I was wrong. She did not seem to grasp that concept. But go around your building and look at the various things that people are doing. Something just as simple as you never leave the Xerox machine with no paper in it, or you never leave your dishes in the sink unless you rinse them off, assuming that you have a kitchen. When I worked for the state, we had a rule that you couldn't bring a state car back with less than half a tank of gas, but there wasn't a rule that you had to get the trash from your drive-through lunch out and throw that in the trash when you got back to the office. And we learned this the hard way when, after a long, hot weekend, somebody got into a state car where the person who drove it before had been to a fried chicken place and left the remnants of her chicken lunch on the floor in the back seat and a bag. So, but nobody had ever said, yeah, don't, I mean, that's common sense, right? Don't leave garbage in the back of the car. But there wasn't a rule for that because you just assume that people know. So it's going to vary from workplace to workplace, or house to house. People have hidden rules in their family. One of the hidden rules in my family was that you couldn't tease my youngest sister. She was the baby of the family and apparently born without a sense of humor. So we learned real fast, you can't tease her, she'd have a temper tantrum. Nobody said that. It was just one of those things you figured out. So you have to really, if it's a hidden rule, it pretty much means it's unconscious. You just do it or don't do it without thinking about it. So it does take thought. It does take a minute to really identify what the hidden rules are. Do I see another one? I see two.
Yeah, you do.
Okay. Just because it might be obvious to those already in an organization or the class, correct. It might be obvious to you, which means you do it without thinking. It's not something you have to remind yourself of every day, which means if you're trying to explain this to somebody else, you really do have to stop and think about what's the process for this? What's the procedure for this? Because sometimes the only way people know they've broken a hidden rule is because the room gets really quiet and everybody's, giving them the stink eye. So it really does take thought. And what's the next one? How does structure and consistency play a big part in Bridges Out of Poverty? Well, I think structure and consistency plays a big part in the workaday setting, whether you're in poverty or not, because people need to know what to expect, and consistency helps people learn cause and effect and consequence. So working in a situation where things go one way one day and a different way the next day is very unsettling. People really do in the workplace, they really, really need to know what to expect and how things are going to go that day. It's just really nerve-wracking, and I don't care where you are in the organization, if you're the lowest paid person in the building, or if you're in the one in the corner office in the big chair, people really do know what to expect. Now, does that mean you're going to know what happens every single day? No, obviously not. But it means you know the things that you can count on, that if this, then that. If this happens, then I know the consequences that. So I think it gives people comfort in the workplace. It gives people a sense of cause and effect in the workplace, and honestly, not just the workplace, but education and whatever organizations that you have. There was a study, it's probably been 25 years ago now, where two gentlemen questioned 75,000 employees in jobs all across the sector, and asked them, what is the most important thing in a leader, a manager, a supervisor? And hands down, the most important thing that a person in the workplace values is honesty. Because I was greatly relieved to see that intelligence only ranked 4th. But if I don't believe you, if I don't trust you, if I can't put faith in what you're saying, it really doesn't matter how creative or how smart you are, because there's that disconnect between what you say and what you do. And I think that honesty results in structure and consistency, because there's an expectation that people know what to expect, and they know what they're going to get from you. So that was really a thought-provoking question. Thank you for that one. I don't see any more questions right now, and so when you get back together on August 5th, I think if you look at the Lego blocks and figure out, what your structure is, both from the individual perspective, from the institutional perspective, which is probably the thing that's going to be driving most of your decisions, right? Because you all come from different institutions. So do we have, from the institutional side, do we have the right people on the board? Do we have the right people who are invested in this as a process, or this is a project in our locality? And then you move upward through the little Lego bridge to make sure that you have all of the pieces into place. I may have mentioned the Getting Ahead in a Just Getting By world book to you earlier, and then you saw it on the Lego bridge. That's a book that you use to in a class-like setting, and use it to help people define what their perfect and ideal life would look like, whether it's home ownership or advanced education or a specific career. And so you start with, where do I want to be? You know, where is it I want to be in a year or 3 years or 5 years? So you draw the picture of where you want to be in 5 years. But what is the step just below that step that you have to be on before you can move on to that step? And you go backwards, you plan backwards how to get to each step, what the step below that has to be, till you gradually get back to the step that the person is standing on now. So depending on what their long-term goals are, you know, some of the first steps might be get your GED, or clean up your credit score, or start a savings account so you can buy a reliable car. And when you start the program in your locality, you have, you know, an instructor who's been trained in the material, and they suggest that you pay your participants so that the people in your class will begin to get comfortable and used to and expect compensation for their time. You know, if I keep you in my waiting room for 45 minutes when your appointment was at 10 o'clock, pretty much showing you what my value on your time is. So when you pay people for participating in something, then they begin to get the understanding that, yeah, my time is worth something. So that's part of it. And even if you don't pay very much, there is still the understanding that my time is worth money. And so consequently, I can make money with appropriate use of my time. When we ran the program in Powhatan, there was a lot of discussion on if we gave the people gift cards as the paycheck, were they going to run down to Walmart and buy beer? Well, you know, if I'm paying you from my business, I'm just going to pay you what we agreed on, the hourly rate times the number of hours you work. I can't sit there at my desk and say, well, I can't pay Vicki, you know, because she'll just run down to the ABC store. That's not what happens in the workplace. So we just made a decision, you know, we will pay them for their time, and how they choose to spend their money, that's a decision that they will have to make. So I think we ran, I want to say we ran 8 2-hour sessions, and we provided childcare and a light dinner because we did it in the early evening, and so we thought that might help people and also might encourage people to come if they knew they were going to get dinner. And I think we only had about 7 participants, which was fine since we'd not done it before. But 2 people out of the 7 ended up with full-time jobs, so we felt like it was well worth our time. And then after you get your first class of people through, and hopefully you have some success with people securing stable long-term employment, then you recruit those people to continue to be the instructors for the next class that you round up and take through that process. So I think the Getting Ahead book is real helpful as far as the practical application of the concepts that you want to implement in the community. So I think your planning meeting in August, you might want to have somebody buy the Getting Ahead book and look it over and see if you think that would be a good program to begin putting some of the principles and constructs to work. And I would also encourage you to include somebody from your banking and financial community, your civic organizations like the Women's Club and the Rotarians. I think you've already got your faith-based people there. So it is a lot. It is a lot to consider and a lot to accomplish. And it can be complex and it can be convoluted. If it was a simple problem, I'm pretty sure we'd have fixed it by now. Part of managing the community action program in Powhatan was going to a training session about community action. And the year that I went, I want to say was the 60th anniversary of the community action program, and it just struck me. Lyndon Johnson started his War on Poverty and his Great Society in 1964, and we're still wrestling with this. So if this was easy, we'd have done it by now. The State Department of Social Services has a training module, and I think they might cover it in the local board training. But it's a history of social service programs in Virginia. And, there was a child labor law passed in 1610 or something like that. And then it comes through, the poorhouses and work camps and child labor laws and the Great Depression and the Work Progress Administration and Civilian Conservation Corps and all of those government programs to help people get out of poverty. So just remember, this is complex and convoluted, but if it wasn't, we'd have fixed it by now, because people have certainly been working on this for a very long time. So anyway, Vicki, I think that I have said everything I can think of to say today. If I don't see any more questions have popped up, unless there are. And has the poll finished?
The poll has finished, and I have not seen any additional questions. So I want to thank everybody for participating with us today. We appreciate your time. If you are not able to continue on the work group, we hope you'll be available if we have questions, and we hope that you'll share the information that you learned with others, especially when you hear some of those stereotypical responses about people in poverty. And again, thank you all for joining us. You will be receiving, if you signed in or signed up through Patty, you will be receiving an email that includes the handouts in reference to trauma and Alice and some additional stuff and some of the charts that you saw with the Bridges Out of Poverty training. So thank you very much. Have a wonderful rest of your week, and we will be in touch soon. Keep August 5th at 10 o'clock in mind. Likely it will be some type of electronic meeting. But we will be back in touch with you about that. Thank you very much.
Thank you all.